If the pain gets worse as you continue to do it, 1, this is not the procedure for you, or 2, you're adding too much compression. Ease up, Hercules. Welcome back to Geek Rehab. Dr. Monte here. I've got an interest from a subscriber regarding pain and stiffness in a toe joint. So basically arthritis. This particular individual had had surgery to kind of debride or clean out the joint and still has some pain and stiffness in that toe joint. So I wanted to address that, and what I'm going to share with you can be used for most arthritic joints, whether you've had surgery or not. And I'm going to teach you a little bit about the different joints on how to move them and address this issue, and what to do if it's painful and if this procedure is good for you or not. The first thing you want to remember is this procedure is not used for acute or recent issues. So anything older than 6 weeks, if your symptoms if you've been suffering from them for over 6 weeks, then you can try this. And this is called PRP, or pain response phenomenon, and it's taught to me by my fellow therapist or physio in New Zealand named Brian Mulligan. What it is, it's kind of counterintuitive to think that you want to compress a joint even further to help reduce the pain, because oftentimes when you have bone on bone, that really hurts. Well, what we're actually doing is we're compressing, creating more bone on bone friction to help reduce the pain. It does work in a majority of times, but if it does increase your pain, obviously stop. So I've got my good friend Fred here. He's kind of a half a friend. We're going to use this joint here. It's the big toe, okay? And you've got 2 joints in your big toe. I'm going to do the one closest to the heel, the proximal one, to show you what you need to do. So if you can tell here, you have this part of the bone right here, the more proximal bone, your metatarsal. It ends in a round shape, okay, or a convex shape. So kind of like a golf ball, all right? So it's right here. And the other end right here is concave, more like the top part of the feeding part of a spoon. So if you put those on top of each other, like so, you want to move this bone like so, okay? It moves on the convex portion of the other bone. So that's what we're going to do with this joint. Now, different joints are shaped differently, so you're going to need to move that joint differently in those. But in this instance, this is how it moves. And this technique works for just about all synovial joints. A synovial joint means it's encapsulated, okay, or it has a capsule around it, kind of like a balloon, and it has synovial fluid in it. That's the lubricating fluid for the joint, and that helps to produce good, healthy cartilage and nutrients to the cartilage and the joint. So you want to hold if your foot was up like this. Actually, this is my other foot. There, that looks more right. Sorry, Fred, I had your wrong foot. So you're going to hold onto this closer bone to you and take the end of the toe, and you hold this one still, but this is the one that you move back and forth, okay, just like I was moving the spoon over the golf ball. And the idea on this is you want to give some compression, okay? So you push in, so you're pushing in towards the other, holding this one still and moving the other one. So you compress it, squeeze it together, and then move it back and forth like the spoon on the golf ball. And you do that for 20 seconds. All right, so here's the trick to it. The amount of compression makes a difference. You want to compress and move it into the painful direction. If your pain goes away in less than 10 seconds, you're probably not adding enough compression. If the pain gets worse as you continue to do it, 1, this is not the procedure for you, or 2, you're adding too much compression. Ease up, Hercules. Okay, so compress, go back and forth. Say, for instance, if it hurts to bring your toe up, that's the direction you want to go. But you don't want to go to end range, all right? You don't want to hit the end of that joint capsule, because that might be giving more pain or stretch to ligaments. And your pain is not the ligament, it's the joint for this instance of the example. So you stay within mid-range, okay? If your joint can go from full range from here to here, you want to stay here to here, okay? Don't hit the end range of either direction. So compress, move it into that painful region or range, about 20 seconds. And if this is the right procedure for you, that pain should go away in about 20 seconds. All right, give it a rest. All right, now come back, do it again, same amount of compression. It should go away within about maybe 15 seconds. All right, once it goes away, you're good. Stop, give it a rest, come back, do it again, same amount of compression, and it should go away within 8 to 10 seconds. All right, until you can do that compression and you do the motion and there's no pain, then you're done. It should take maybe 5 minutes. And each time the pain will go away either quicker or it takes more compression to bring on the pain. Okay? So you can do this on a daily basis and it should have some prolonging benefits. So meaning it doesn't take 20 seconds for it to go away the next time, or it takes more compression to even bring on the pain until that pain is no longer there. I like to use this also when I am having active pain. I start doing that to the joint to take the pain away, okay? So like I said, you can do that to any synovial joint. My example was to that toe joint there for my friend. And you can do it to your finger joints, your wrist, your thumb, wrist, different joints. The problem is you need to stabilize the one side while you move the other. And you've got to know the shape of the joint to know which end you're moving and how you're moving it. And so that's where you kind of need to take a professional's opinion on knowing the shape of the joint, or get your anatomy book out and check it out. So you have on some joints, you have a convex side and a concave side. You either roll this like that, or in some instances, you spin the convex side. Or if you have two flat surfaces, you don't roll or spin either one. You have to glide it, okay, like that. But talk to your professional to know which direction is the right one for the joint surface you need to work. So hopefully that helps you in reducing the pain of those arthritic and painful and stiff joints.